Hello and welcome to the latest show of IMTV. I'm your host for tonight. My name's Adam Booth. I'm the editor of socialist.net, the website of the British section of the International Marxist Tendency, Socialist Appeal. And tonight we're going to be discussing with Adam Powell, who's the editor of Lal Salaam, the publication of our Pakistani section of the International Marxist Tendency. The International Marxist Tendency is an international Marxist revolutionary organization based in around 40 countries across the world, and Lal Salaam is our Pakistan section. So far, in previous shows, we've been hearing from comrades in America, from Italy, about the impact of the pandemic there. But today, we're going to be discussing the impact of the pandemic in the Indian subcontinent, in Pakistan, in India, where obviously very different conditions exist. And we want to hear from Adam about those conditions, how they're affecting workers and the masses in the Indian subcontinent, and what kind of movements we're seeing against these repression and against these conditions. Just a reminder, obviously, that you can comment on YouTube, on Facebook during this stream, during this show, and we might have time for questions during the end. Please bear in mind, obviously, that there are a lot of internet connectivity problems trying to connect to Adam on the other side of the world, so please bear with us if there's any slowdown or drop in quality. But without further ado, let me get Adam on the line. Hello, Adam. How are you?
I'm fine. Thank you, Adam Booth, for inviting me in this show. And
Well, thank you
really
very much
thankful
for
for
joining us today.
time.
We hope you're all staying safe and healthy, the comrades in Pakistan.
Yes,
And
of course.
I was just saying to the viewers that basically, so far we've been interviewing mainly comrades in Italy. We spoke to Claudio, one of our comrades in the Italian organization, and John, the editor of Socialist Revolution in America, who's based in New York. And very different conditions are seen over here. Obviously, the pandemic has affected thousands of people in terms of deaths, but at the same time, there is, a relatively decent welfare state or healthcare system. How is the impact of the pandemic in a country like Pakistan or India, where there's very different conditions? What kind of impact have we seen so far?
Thank you, Adam Booth, first of all, giving me time for this show. And of course, everybody here is following news about Italy and Spain and United States, especially in New York. There have been a lot of talk here about the crisis in Europe, in the United States, and especially just so many deaths for which everyone here feels sorry and is sympathize with the families there and the comrades there who are facing this horrible circumstances, horrible conditions. Even nobody could predict this few months ago. And the comrades in Italy and all the working class people in Italy and United States to pass through these very difficult times. And keep comrades here are very concerned about those comrades, and especially in Britain, France, Spain, everywhere in the Europe where this pandemic is a catastrophe for the working class as a whole. And similarly, the situation here in India and Pakistan is not very different, or if you can say it is much worse than the situation there. But the dilemma here is that it is not being reported on media. As you can see that already there have been reports that deaths in Britain were underreported at certain points, and similarly in other countries. But if you talk about India and Pakistan, the situation is grossly underreported, and there are serious curbs on media, and there is no not proper reporting here, and governments all over this region are trying their best to stop every kind of report coming out. And only if the real situation is being revealed, I think that will be a huge that would have a huge impact in the societies here and all over the world.
So
But this is a
Adam?
criminal act by the
Sorry.
governments in both India and Pakistan, in which they are not they have subjected to the whole populations of this virus and are condemning them to death and misery.
So can you tell us a little bit more than exactly what the conditions are? Because you're right, this kind of news hasn't even really reached us here in Britain or America or Europe. We've had a lot of focus in the media about the conditions and the deaths in Europe and America, but there's been very little talk of the impact of the virus in the rest of the world, and particularly in the ex-colonial countries that have been ravaged by imperialism. So can you explain just how deep the impact of the crisis is? You know, what kind of conditions are ordinary people facing in Pakistan and India as a result of this pandemic?
Yes, of course. Just as I was saying that due to advanced countries in Europe and America, there is vast presence of media and other reporting, and people are also reporting on social media and elsewhere. But here you can see that the governments have are curbing the media, and media independent media freedom is not very much available here, and this is a luxury actually. Reporting the correct situation on ground is a big luxury in both India and Pakistan, which most of the people can't afford. The actual situation is there that Pakistan has reported only 100 deaths so far, while India has reported around 400 or more deaths so far. But which is a huge underreporting, I think, and the situation here is really bad. And in Pakistan, if you see that the health system is almost non-existent on the ground, and whichever few hospitals were available have been not working properly, and even the health workers are being infected on a big scale, and some have started dying already due to coronavirus. And similarly, due to the lockdown, especially in India and Pakistan, there have been a lot of deaths due to hunger and poverty and disease other than coronavirus. Already there were huge, you can see cases of deaths from malaria, from TB and other diseases. Just like if you might know that polio is one of the disease which has been removed from all over the world, but only in Pakistan and Afghanistan it still persists, and many people are affected by this. So there are many other diseases from which people are affected and die every year. But now, due to lockdown, there are no transport facilities, there are no hospitals available. Private hospitals and clinics have been closed down because of the fear of the coronavirus, and similarly, public hospitals are not doing OPD and are not catering to patient, addressing the patients coming to them other than corona, because there are no protective kits available and no other protective procedures available in those hospitals. So many people are dying from heart diseases, from lungs diseases, from other diseases. Even pregnant women, more than 100 women die in Pakistan every year. But due to this situation in lockdown and not availability of hospitals, the actual number can be much higher in these circumstances. And as far as corona pandemic is concerned, there are no face masks and basic protective equipment available for health workers across India and Pakistan available. And similarly, for other essential workers, is not available, and due to which it is spreading. And as you can imagine, that there is no testing kits available in both India and Pakistan, and the speed of testing is one of the slowest in the whole world. And if you see in India, they are testing around 15,000 people on an average every day. It's today's report. So you can imagine that with the population of 1,300 million, how far they can see that if this is spreading or not. And if you compare it with the Europe and America, this even testing shows that what is the extent and what is the reality on the ground. And then
So
in Pakistan, there have been cases of testing kits which are fake or which are expired being used in different laboratories, which shows that the quality of testing is even not ensured, and some positive patients might get negative results, or negative patients might get positive results, or whatever it is. So overall, the situation is that the whole of the system and the crisis has been exposed, and all of the contradictions have come to the fore, and millions and millions of people in the whole region are without any support, without any medical support, without any health system, without any food, without any protection, and they are living in slums or poverty or without food. There have been cases. Yesterday, somebody reported from Islamabad in Pakistan that a journalist met a family which had not had food for 10 days due to lockdown and other conditions. So there are people, and there are cases in India where people have died of hunger due to lockdown. There were no transport available, and they had to walk back from cities to their homes, from which some even walked for hundreds of kilometers, like 700 kilometers or more, and many people died on the roads. Similarly, by police torture to enforce lockdown, many have died. And
and
similarly, there
Adam,
are this huge massacre going on in this region, and there is a very, very, very worse situation. And in the coming days, it is going to be much worse.
so and can you tell us a little bit more then about the date?
Similarly, if
Can you, Adam?
if you like,
Sorry, Adam? Can you
yeah,
just
yeah.
tell us a little bit more about the economic impact then? Because obviously in the UK and other places, people have gone into lockdown. Some people have still been forced to go into work to make profits for the bosses. Other people have been paid to stay at home. The government has stepped in and paid people's wages. Other people are able to work from home. And so self isolation, social distancing, can just about work in a country like Britain or in Europe or in America. But what does that look like in a country like Pakistan or India? What's the effect on people's jobs, on people's day to day lives, on people's economic conditions? You talked about starvation and things like this. I mean, presumably the impact of the pandemic is 100 times worse in that respect in a country like Pakistan or India.
Yes, here you might know that it is one of the areas of the world which was already one of centers of the poverty and misery. People were living in extreme poverty, misery, and joblessness. Unemployment was already on the peak in last few years, both in India and Pakistan, and there was a crisis already. Economic crisis was already looming in India, but in Pakistan, from last 2 years, it has been expedited, and there were more and more job losses in last 2 years in Pakistan. But after Corona, there is led to a explosion, you can say, and this is like a class war. Is opening up of a new phase of class war in India and Pakistan, where rich are attacking the poor with whatever they can. And as you can, there is one report about Pakistan that due to this pandemic, 15 to 25 million jobs will be lost and already lost, and millions of people had to send back from work. And more like in Pakistan, especially 80% of the people work on daily wages, or you can say contractual employees, and there is no job security or any wage security for them. So they were just laid off and sent back to their homes without any wages. And this is a very common routine in Pakistan, that industrial workers and even corporate workers are not paid wages for like 3 months or 6 months. So same was the situation in this virus, and they were just had to go home. And when there was lockdown was announced, they were not given wages. They didn't had enough to feed, because here people just live. Most of the people, working class people, live from day to day basis. They buy their meals for themselves and for their family every day. when they get wages, they buy the meal, and when they don't get the work or wages, they don't have enough to eat. So for a lockdown for almost a month now in both in India and Pakistan, like millions and millions people had to live without food and without any basic things. And the governments are pretending to support the working class families and are pretending to give handouts or cash or some like food items to the public. But this is just like a you so a political gimmicks or something like that. On the ground, nobody is getting this, and maybe somebody gets uh, a food for one meal or two meals, but most of the people like Pakistan, there have been reports of food riots in many cities in Karachi, in Lahore, and in other places where like hundreds of people come out being reported on the media as well. So the situation is very bad, and similar conditions in India as well, where a lot of workers from rural areas to cities, they had to be sent back in hundreds of thousands, but they had no transport to go back. And similarly, who were left behind in cities have nothing to eat, and they are left without food, without jobs, and
Well,
without
can
any
Adam,
health protection as well.
Adam, can you just go into that a little bit more? Because one of the things that has been reported over here is the reaction of the Modi government to the pandemic, where it's reported that Modi just suddenly overnight announced a very extreme lockdown and forced suddenly a lot of migrant workers back to the villages. But then once they got there, they were then turned back as well for fear that they were bringing the disease into these villages. So it sounds like it was complete chaos in India. So can you just explain a little bit more about the kind of steps that the governments have taken in India and also in Pakistan?
Total clueless, and they had no idea what to do and how to tackle this situation, and they are just doing at best is media management, which is called professionally, and that is all they are doing. And similarly, along with that, they are trying to protect the rich and the ruling class and the wealthy from this disease and overall the situation. And if you consider the lockdown announced in India on 24th of March, it was a very sudden announcement. There were no preparations for this. There was no planning for this. There was no government departments or state governments ready for this. And suddenly it was announced, and nobody knew that what will happen after that. The 21-day lockdown was announced on 24th of March, and suddenly, like hundreds of thousands of workers wanted to go out to their homes, to rural areas, and government announced that there will be say what they call social distancing or safe distancing. But suddenly you saw hundreds of thousands of people on the bus stations in Delhi and in Mumbai and in other metro cities. And there were no trains available, there were no buses available, and then there was black marketing, and then everything was not available. And then when they were went back to rural areas, they were also condemned. There was stigmatization of that they are carrying corona pandemic as well. So many had to walk on foot. Many had to rely on just overcrowded bus or anything which was available on very high prices and things like that. And then many were left alone in those cities and without food, without any shelter, without any basic provisions. And they are still facing those. And similarly, in Pakistan, the situation is much worse than that, because nobody knows in Pakistan that who is running the government, because the prime minister publicly said that he's against the lockdown, and like two, three times he came on the national TV and spoke, addressed the nation that he's against the lockdown. But no, somehow there were from other departments and from other sectors there was a lockdown, and on the ground people when realized that it was a partial lockdown. And then the situation, similar situation, that no food and no health and no other provisions were available for the majority of population. Then as far as the industrial workers are concerned, many industries were allowed to run in Pakistan and in other places as well. And still there are certain big tycoons who have got benefits and are still they don't fall under the category of essential services, but still they were running industries, and there had been reports that workers were forced to work in very dangerous conditions in those industrial sectors, and which has led to crisis as well. And even in India now, the lockdown has been extended 2 weeks more, and it will will be enforced till 3rd of May. There, the Indian government is preparing new condition that the factories can, if they want to run, they should have to increase the shift from 8 hour work to 12-hour work, which means a lot of more exploitation and similar measures for the benefit of the ruling class and for the wealthy and from the for the bourgeoisie of both India and Pakistan are being taken. In fact, it is an open class for in both India and Pakistan, which is in which the economic crisis, the burden of the economic crisis, the burden of the coronavirus is all being put on the shoulders of the working class. They are being left to die in slums, in poverty, in hunger, in destituteness, in without any health. Today, there is a report from Karachi, in Pakistan, in which it has been reported that a lot of people are being brought to hospitals who are either dead or when they reach hospital they die in few hours, just because the people do not bring corona patients to hospitals on time because they fear that they will have to face dire consequences. They will be sent to some quarantine, which is they think is like jail, which truly are like jails without any facilities, and they will be left to die in quarantines, or they will whole of them will be condemned as being corona patients, and they will not get any food or any jobs later on. So they are not bringing their patients to hospitals in Karachi and in other parts of the country as well. Same situation. And if they bring it, is almost dead or uh, uh, going to die in few hours. And then when they take back the dead bodies, they are not allowing it to get tested or post-mortem or any precautionary measures for the dead bodies to get buried. So
So
it is
Adam,
already chaos here, and there is an open war against
so well, yeah,
working class here.
you talked about this war against the working class, which, as you say, is going on in Pakistan and India, and it's going on across the whole world. You know, as you say, the ruling class is attempting to put the burden of this pandemic onto the masses, onto ordinary people, onto workers, keeping open production that shouldn't be open to in order to keep making profits, not providing protective equipment for healthcare professionals. That's something we're seeing here in the UK as well. So, can you explain, however, what are workers doing to fight back? I know that the comrades in Pakistan are part of the Red Workers Front, and that you've been conducting campaigns with healthcare workers and others to demand these kind of measures of protective equipment and so forth. So, can you explain a little bit more about what kind of response we've seen from workers against this attempt by the bosses, by the governments to put the burden onto the workers, and what kind of campaigns are the comrades running in Pakistan to demand health and safety measures?
Yes, first of all, Adam, you are right that this is the crisis in all over the world. And the sane response for this virus and whole situation would have been to a worldwide planning, one plan for the whole of the world, in which all of the resources of the world would have been used and would have been managed to get rid of this virus and to control it. And all the resources would have been put into research for vaccine, for face masks, for ventilators, for everything. But what we see everywhere is that governments fighting with each other over ventilators, over face masks, and face masks and nationals, and leaving working class people to fight their own life for their own lives on their own without any. So this has exposed the limitations of capitalism, the limitations of national states, and the limitations of so-called international forums like United Nations or European Union or IMF or World Economic, which is clearly shown that they are bankrupt and they have no capacity and capability to tackle this issue. Rather, we see like big economies like America, China blaming each other for virus and fighting against each other. So it clearly shows that a world socialist revolution or a world socialist planned economy would have tackled this in a much more advanced way. Similarly, in India, Pakistan, we still see that the ruling class of both countries is accusing each other, and there have been shelling on the borders. Has been a attacks on the people in the Kashmir issue. Modi government is trying its best to strangle the people of Kashmir much more. They have issued new draconian measures for the citizens of Kashmir in Indian occupied territory. And then there in the Pakistani government and Pakistani state has been using all its resources to further the Islamic fundamentalism, whatever it has been doing. So they are least concerned about the welfare of the people or for the health facilities or for the food or the starvation of the people here. And what we see here is all the political parties have been exposed that no party has an alternate program or an alternate appeal for the working class or for the whole situation for which they can fight. So in this situation, the Red Workers Front has and the comrades have come forward and given a complete program in Pakistan and elsewhere as well to fight how to fight this crisis, in which we put the demand that first of all the resources of the country should be used and to fight this virus. All the rich and the industrialists and the bourgeoisie should be expropriated, and all its wealth should be used to protect the working class from this massacre and this huge deaths which are being imposed on the working class by this system actually. So, and along with that, we have said that all the private hospitals should be nationalized immediately, and all the private hotels should be used as quarantines. And similarly, in Pakistan, like in every city, there are on the outskirts there are luxurious towns and housing societies for the rich, which have huge bungalows and which have huge spaces. So we put forward the program that should be expropriated immediately and that should be used as quarantines for the working class people who are being affected. And similarly, the government should provide food and shelter and housing and clothing to every person. That should be the responsibility of the state. But Pakistani ruling class comes again and again on TV and says that we are a poor country, we are helpless, and we appeal to the international financial institutions for help and this, and asking for donations again and again and again and again, and asking for charity from the rich to the poor. But we think that charity is not the solution. The appealing to these bloodthirsty capitalist and imperialist powers of the world is not the solution. The only solution, the only way forward is the expropriation of all the capital and all the commanding heights in this country and using all those resources. And for that, we have taken this message to the health workers across the country. And there have is a big struggle of the health workers in Pakistan actually, and that was going on for last many years as well. And that started with the young movement of the young doctors like 10 years ago. But with the passage of time, all the health workers united and built a alliance which is called the Grand Health Alliance in Pakistan, and it was is present now in all parts of the country, in all provinces, in Gilgit and every other place. And in which alliance there are health workers from janitors to nurses to paramedics to young doctors. Everyone is a part of that alliance and are participating in it. In fact, the government of Pakistan was privatizing the public hospitals on a very rapid scale on the instructions of the International Monetary Fund (IMF), and is carrying out very aggressively. And when this corona pandemic started, and there was panic among the health workers that how we will fight, and the government Pakistan used this as an opportunity to attack this public health and privatize in the largest province of Punjab all the public hospitals, and passed a law in Punjab Assembly in which all hospitals was privatized. But still, the workers from Grand Health Alliance gave up a huge resistance, and they fought against these attacks, not only of privatizing the public hospitals, but for the provision of a basic protective equipment like masks, like other protective equipment. You might have read the reports that N95 masks are not available in Pakistan and India, like ordinary face masks are not available. There's big scarcity of that, and health workers are working in hospitals all over India and Pakistan without face masks, without any other health equipment. Just like in situation in New York and London is not different, but here it is in a much bigger scale that people are without ventilators and without basic equipment. And you might know that in both India and Pakistan are atomic powers, and they have nuclear weapons, both of them, but they don't have ventilators, they don't have
Mm,
face masks, and
mm,
they don't have N95 masks and other basic equipment for their health workers. And when in Balochistan, just like in when health workers came out to protest, even in these dangerous conditions, even doing a protest is not safe, but they were forced because they were working in unprotected environment. So they were forced to go for a protest. And when they went out for a protest outside the chief minister's house, they were brutally tortured by police. They were attacked, and they were thrown in dozens in police vans and taken to police stations. This is the response of the government when health workers ask for a basic protective equipment. A similar situation in all other cities across the country, in Islamabad, in Peshawar, in Lahore. There have been many protests. Just a couple of days ago, there is a city in Pakistan, it's called Multan, where a large number of health workers have been diagnosed with the coronavirus. Like doctors, 4 or 5 doctors have already died because of this corona, and more than 150 have been corona positive now. And because there is no testing available even for health workers in Pakistan, and similar situation in India. So we will see that in the coming period, many health workers will be affected by it, and many would lose their lives just because government is not giving any protection to that. Red Workers Front was in the forefront, is one of an integral part of Grand Health Alliance, and is always coordinating with it and participating in their agitations and strikes and all others. And they have supported this. And when they were arrested, they were also leader of Red Workers Front there was also arrested, and they were part and parcel of that struggle. Similarly, we have also in contact with the workers from other sectors, just like the PIAs, Pakistan International Airlines, which is the state airlines of Pakistan. There is a big there issues there of coronavirus, because the government was asking the crew and the pilots to continue some of the flights, just because, as you know, that thousands of Pakistanis are stranded in other countries because there's a closure of flights and they wanted to flights back. But the flight crew demanded protective equipments before getting onto flights, but that they were being denied. They were forced to continue the flight operations without any protective equipment, on which the pilots of the Pakistan International Airlines went on strike. They said that we will not come on to job unless we are given the assurance of our protection. But again, there were negotiations, and they were convinced that you will be given protective equipment. But and then air hostesses and other cabin crew and others were also asked to come forward and participate in this emergency period. But that they were not in the end given protective equipment, and now there are reports that one pilot and 4 cabin crew members have contacted coronavirus.
So,
And
Adam,
you can see that there is no security and checking available even in this special period of flights, and passengers are not being tested, and there's a very difficult conditions.
so uh,
Similarly, in industrial workers, there is a very difficult situation, and the Red Workers Front is trying to bring all those on one platform through social media, and trying to record protests through social media, because protesting on streets and on roads is not very well suited for this current situation.
So Adam, you've talked a lot about the sharpening of the class struggle that's going on as a result of this, the mood of anger that's developing, the conditions of misery and poverty that the masses are putting up with. How do you see this pandemic impacting on the class struggle going forwards in the region? Because it's not like there was stability in Pakistan and India and Kashmir before. You mentioned already the repression in Kashmir, the repression of the Modi government, the mass movements, the general strikes that we've seen in India and elsewhere. So clearly, this comes on top of a period of already intense class struggle in India, Pakistan, Kashmir, and across the whole region. How do you see that developing? As a final question, really, how do you see that developing in the years ahead as a result of this pandemic?
This whole situation, I think, is pregnant with the revolutionary consequences, and this class war will ultimately lead to a revolutionary situation both in India and Pakistan. And if you see the conditions in India and Pakistan, they are not much different from the period before that of the French Revolution in France, or before that of a Russian Revolution of 1917 in Russia, where people were forced to eat rats and other insects, and they were condemned to misery and beggary and other diseases, and were condemned to die in those situations. And they ultimately moved towards revolutionary situation. The situation is developing on a similar basis. If you see around this whole and even everybody can see that and can predict that. Even there have been certain video clips of the people from the ruling elite in Pakistan that gone viral, and they were scared. And one of the person of a ruling elite sent a video message that I was passing through a road and I saw hundreds of people looking towards my luxury car with their eyes, and I could see revolt in their eyes. And in the coming days, we will have to have weapons with us when we go outside on the road. This was the message of that person in that video message, which has gone viral all over Pakistan and beyond. And they can clearly see with the food riots and everything else, the revolutionary situation is developing. And even in India, you see in the past months there will be huge protests. Millions of people came out against streets on the citizenship law by Modi and other draconian measures he has been taking all over in the last period. So this has been a certain pause in that mass protests and mass meetings, but ultimately the situation is worsening. The economic situation, the economic crisis is has multiplied like thousands of times. Like, and you can say that exponential growth of the crisis in Pakistan. In Pakistan was a verge of bankruptcy, economic bankruptcy, even before this pandemic. It was like millions were being laid off from jobs every month in Pakistan for last 2 years. The Pakistani currency was being devalued at a very rapid scale in last 2 years. Similarly, in India, the currency has devalued, and if you have seen the report of IMF that $100 billion from the poor countries, or you can what they call the developing countries, have been transferred to the advanced world in just 2 months. $100 billion in 2 months is a huge amount, and people are taking their money out from Pakistan, which shows the panic amongst the ruling class that they see what is coming. The storms are coming, and they're taking out their money. Most of the rich people in Pakistan have flown to their luxury islands in New Zealand or in Europe or other places and have secured themselves up, because the situation is going towards a really worse and worse in the coming days, because the economic crisis will not be overcome in the coming days. And overall, there will be a collapse of the society, collapse of the economy as a whole, collapse of the whole system, and collapse of the state machinery and everything else you will see in the coming days. So that is the whole revolutionary situations are building up in this whole region, and I think the working class is the only force in this region, and I think on the whole planet, which can bring this society back to life, to bring it out of misery and all this poverty and hunger and disease and all this killings which are being imposed on the people by this murderous capitalist system. So I think that there will be huge political and social changes and revolutionary developments in whole of the region in coming period, and Marxists should be prepared for that, and they should take the message to this working class everywhere that the only way out of this is to overthrow this capitalist bloodbath and carry out a socialist revolution to end this.
Thank you, Adam. I think that's a very good place to end for today. Unfortunately, your connection's breaking up a bit, so we should probably leave it there. Unfortunately, won't have time for questions, but thank you very much for joining us and for telling us in vivid detail the conditions and the fight back that's taking place across the region. We wish you the best of luck, solidarity to yourself and all the comrades in the Red Workers Front in Lal Salaam. Solidarity, comrade. We'll hopefully see you when the pandemic is over. Thank you very
Thank
much.
you, Adam, for all your time, and also solidarity to the workers in Europe and America and all over the world, and forward to a socialist revolution.
Thank you, comrade. See you soon. Okay. And thanks to everyone at home who's joined us today. Apologies that we weren't able to take more of your questions. Obviously, technical limitations prevented us from having too good a connection with Adam. But stay tuned, obviously, to our social media channels on Facebook, on YouTube, on Twitter for further episodes of IMTV. Next week, we're going to be joined by Rob Sewell, the editor of Socialist Appeal, who's going to be talking about the life and ideas of Lenin, because the 22nd of April, next Wednesday, is the 200th birthday, the 150th birthday of Lenin, the leader of the Russian Revolution and the Bolsheviks. And Rob's going to be telling us about his life and the revolutionary ideas of Lenin and their relevance to today. So join us again then. In the meantime, obviously, follow Marxist.com for all the latest news and analysis. And of course, stay safe and healthy. See you soon.